Okay, we are now recording. It is June 14th, 7:05, and we are beginning our Health and Human Services Committee. And today we have Vertex joining us to present. You can take it away.
Thank you, Madam Chair.
Go ahead, Jenny.
So, do my thing. I've been doing my thing since 5 o'clock this morning, so I'll continue to do it for 45 minutes before I crash.
Estoy haciendo tu cosa. That's right. Do your thing.
So thank you, Madam Chair, and everyone at the board. We appreciate that you're giving Vertex the opportunity to present to you today regarding the services and the expansions that we're looking to add to the current services that we provide at Vertex. Vertex is a for-profit organization located in the North Bronx section, specifically 1080. For those that don't know, we're located at 1080 East Gun Hill Road. We've been providing services, substance abuse services, since 2006. We have an array of services there that include outpatient mental health, substance abuse counseling, parenting. We have a criminal justice track for those that are specifically tailored for that. We work very closely with New York City Department of Probation, parole, and in fact, as of last week, we've been, or at the beginning of this week, we are currently working at Rikers with the Department of Corrections, training correction officers and some other of their civilian staff on substance abuse and mental health services. We're very excited about that contract. We're very excited to be able to bring our services and to corrections, obviously, with everything that's going on at the island. And what we're looking to do in the next couple of years is really expand our outpatient services. Specifically, we're looking to do a mental health clinic and be licensed by OASIS. And we're also looking to provide additional services specifically for substance abuse. We're looking to do a methadone clinic so that it all becomes a one-stop shop for the company. Does anyone have any questions at this time that I can clarify, expand on?
Yes. So this is what you want to do, right? What have you been doing in the past and for how many years?
So since 2006, Vertex LLC has been providing it's a licensed substance abuse program.
At this location on Gun Hill.
Okay. Yes, that is correct. And okay. And we also have it in a satellite office in Brooklyn, also licensed.
Okay. Any questions from our board members before she continues?
Yeah, I have one. What are your credentials? Because looking at your website, you have nothing on it that explains what you are or who you are, and there's so many typos in your presentation on your website. I don't understand what your purpose is.
Are you looking at the current website that we have? Because we've
the present one, yes.
VertexLLC.org.
I believe that's it. Yes.
There are no typos in that.
Can you put it on the chat?
It doesn't have. Jenny could, because I'm driving now. But our credentials are we're state licensed. We've been there going on about 18 years. We provide services at the Ready, Willing, and Able, the Doe Fund at their shelter. We provide services there. Vertex has had an office on Rikers Island for the past 8 years. We're in the Donald J. Cranston Judicial Center out there. A Vertex staff member sits inside the parole hearings with the judge, the district attorney, the attorney, and the inmate, and they make referrals based on the needs of the client. So not all of them come to Vertex, but the people are returning to the community. They're going to return whether or not they have structured supervision or not. So we consider ourselves to be partners with them. We also have an office in the Bronx County Family Court Building. We've had that office for about 9 years. We have an office there. We're on site and parole in the Bronx. We're on site and parole in Brooklyn. We're on site and probation in the Bronx, adult and for juveniles. And we have medical assistant treatment. So in addition to how the things that Jane talked about, we're ACS, our parenting program, completion of that program, if there's a child being removed from the household, completion of the program stops the removal. if the child is has been removed, completion of our parenting program has a child placed back in the home. Our DWI program gets your car back and your license upon completion of that. We have domestic violence, which we're a domestic violence track, which we're very proud of because most programs just do the victim. We also do the batterer. So therefore, after the person maybe has gotten help, the batterer is still out there. We address those issues also with those folks. So
Thank you. Thank you.
And aside from that, we're also, in terms of our staffing, we have LCSWs, which are licensed clinical social workers. We have master case act professionals. We have LSWs. I myself am an LCSW. We have doctors. We have nurses. So we're fully professional and licensed to provide an array of services.
Kathy Pagan is our medical director.
Okay,
Dr.
thank you.
Pagan. You're welcome.
So I brought the
Carla, you
website.
have your hands up? I'm sorry, Jen. We have somebody with their hands raised, a committee.
Hi, it's Carla. Just following up on what Mr. Stricker said, there is absolutely no background on the clinical training or education industry experience of the 3 lead people on your website. So especially Ms. Torres, clinical director, there is no clinical experience, clinical training noted in her bio. Can you speak a little bit to that?
Yes, I can. Ms. Torres is a master case act. Ms. Torres has a bachelor's degree and a master's degree in administration. She has been the director of other programs. She has probably, I guess, I'm going to imagine about 15 years experience doing this. As for me, I'm Human Service Board Certified Professional Certification. I have a master's in addiction counseling. I have a master's in public administration, and I have a master's in criminal justice. I was assistant commissioner in New York City Department of Probation. I was director of substance abuse intervention division for the Department of Corrections, delivered services on 7 of the 9 jails on Rikers Island. And I've been doing this for a while, so I don't know exactly. Does that cover it, or no?
Yes, I guess I just found it difficult getting a handle on what your management team was bringing to the table because it's not on their bios on the website, and that just made me ask that particular question. So thank you for clarifying.
John Isaac has his hands up.
Hi, good evening, everyone. Actually, my mom was a substance abuse counselor here in the Bronx for like 30 years, and I really respect what they bring to the community, and we really need it, especially with the problems that we are having these days with the drugs and addiction and everything. And I actually know Paul and the guys for about 10 years also. So,
Wow.
you know, they're a real outstanding guy. Even though he can't spell, he spelled his name wrong. But, you know, they're a really good outfit.
Thanks, John.
I was driving while I was typing, John. Stop it. Okay.
Sherry, you had your hands up?
Yes, I have a question. I was looking on your website and I see that you have 2 offices here in New York City, one in the Brooklyn and one here in the Bronx. And I also see that you have one in North Carolina. How did you happen to make it to North Carolina, or was North Carolina the original spot, or?
No, the 1080 East Gun Hill Road, that's the original spot. We went down to North Carolina. We had a program down there years ago. I live between New York and Virginia, and North Carolina wasn't that far. And someone called me down and said that they had a tremendous drug problem down there. Elizabeth City is like near the water. Johnson County, which is not too far from there, is a small area, but most of the people's homes down there are on the water. So for a lot of the fentanyl that's imported into our city comes in through Johnson County, and it comes up to the eastern coast. So we went down there. We met with the police chief. We've been down there. We've been doing Narcan trainings with at the American Foreign Legion down there. We've done that. We've done a couple of Narcan trainings over at the college. We've did it with the football team and the basketball team, and some of the students there just trying to do awareness, because the fentanyl, even though it's a small congested area, from my perspective, it appears that more people are overdosing and dying from fentanyl than there are up here. And based on when you juxtapose the numbers and compare and contrast the density of the people and how many people are up here compared to Elizabeth City, the numbers jump off the page. Not normally, but usually when we're there doing a training, because we're with EMS, we're with the police department, then the alarm goes off and some of the ambulance drivers have to leave. And we've had actually, while we were doing the fentanyl training and the American Legion, about 3 blocks away, a woman overdosed and died before they can even get there. So the need is there. So we basically do it based because that's where the need is.
Okay, I have a few questions. John, you have your hand raised?
See, I have a question for Paul. Like with the expansion, how are you gonna avoid having like, like certain centers have to have like police in front of it, and then there are addicts just like hanging out in the front and all that stuff? Is that gonna create problems for the residents that are on Gun Hill or anything?
No, that's a good question, John. I was the administrator of a methadone clinic for a number of years. Medicated probably 1,000 people a day. Out of the 1,000, maybe 980 of them left and went to work, and the people that you see that are bent over doing something like that, they're doing something different. The people who are on methadone from the medical model is just like when it's working, you take it. It's like if you have high blood pressure or you have high cholesterol. If a person's walking down the street, you can't tell whether or not that they have high cholesterol and they're taking cholesterol medication. And the same thing with methadone. But to prevent that from happening, there would be security to make sure that people are leaving the area. So for those few people who are maybe abusing and taking other drugs along with it, because methadone, after you take your medication, if you drink a beer or use any type of other drug, benzodiazepine or Klonopins or something like that, it would have you in a stupor. But methadone is a medicine. From the medical model, your people who are taking methadone, those are their attorneys, their doctors, the heads of corporations, their executives, their professors, and the methadone is just a medicine. We would probably be more than likely doing methadone abstinence, which would also mean you will be on there for a specific number of years. If you find that the medical assistant treatment, this would just be another tool in our tool basket. Because right now we're doing Suboxone, buprenorphine. If someone likes Vivitrol, which is an injection that you take once monthly and puts the blockers in between the receptors so that you don't be able to use drugs or have that craving. So in order for us to be more effective, we have to have a larger cadre of things that we can do. And also with that, we try to treat, at Vertex, we treat the whole client. So if a client comes to me and they're illiterate and they're homeless and they're using drugs, and then I assist them, and then they're sober and they're not using drugs. If I didn't get them into a training program to be able to be employed or get a roof over their head, or to be able to get them to get a literacy program or something, whatever those other things are, then we're not treating the whole person. Because we have to keep in mind that the drug usage is just a symptom of the problem. The drugs are the problem. And people are using drugs because they're in pain, because maybe they were abused, maybe they didn't have a family, maybe, you know, we don't know. They might be in an abusive relationship, might be a victim of domestic violence, you know, they might be financially abused, whatever it is. And those are the things that tend to drive people who use drugs. So in addition to doing that, we also have to address whatever the issues are with the folks so we can get them from point A to point B. Because the people are returning back to the community. They're going to return back, you know, whether we're assisting them or not. So we're imagining that if we can assist them, it'll be better. We can send people back homes. They could be the head, they get back to their homes and their families. They could be the head of household. They could come out and they can get employed and they can get a job and they can pay taxes and they can be in debt like the rest of us and everything is good.
Paul, thank you for that. That was a lot, real fast for us
I'm
to respond to
sorry,
that.
but I
Thank you
tried
for
to
that,
get it
though.
in. Thank you.
My background is in mental health, so in the mental health field, so I appreciate what you're sharing,
Really.
but we do have some concerns, right? So up until now, you haven't had a methadone clinic at this location. I'm asking.
We haven't.
You
No,
have
we haven't.
not. Okay.
Sorry.
And have you taken into consideration that there is a school about 2 blocks west from this location?
Yes.
And so how do you see yourself troubleshooting that, right? There's a lot of activity with the school, the train. What is your method for managing that?
That's where the security piece comes in. There would be people out there to make sure that those small amount of people who are maybe struggling or trying to acclimate themselves into the drug-free process, those people will keep it moving. We'll have those moving. I don't anticipate there being any problems because someone is on methadone at a school. No.
But your security reaches beyond your location? They walk up and down the corridor of Gun Hill, or it's just
That's
securing that location right
no,
in
that's
front?
well, how it works best, when I've seen the model, how it works best, the community, the people in the community, shop owners, everyone knew who the security were, and they made sure that when our clients, the ones that may have been troublesome, that when they're leaving, that they're leaving the area.
Okay.
But then again, that was a small amount of folks because the majority of the people, they come in, they get their medication, and they, you know, go to work or they go to school, wherever they go. And depending on how long you've been doing, they will come in once a week. Some come in once a month. So they would come in for counseling with the medication they would have at home. Many of them, they take it at home. They come in.
And about how many clients, patients do you have now compared to what you're anticipating? What is your goal? Like how many patients are you trying to serve?
We have 250 clients now.
Wow.
The number of people that we will have in the program, that will be determined based on the availability for people who want to leave from the programs that are further downtown because there's no program up in our area. So that would be determined between us and between the OASIS, our state license agency, the
So
oversight agency.
you don't have a capacity, like a limit. It can be on an unlimited amount of patients or
No,
clients.
well, no, it wouldn't be unlimited. It probably, the maximum that you probably could have would be 500, but I doubt if it would be that.
So a max of 500 with the new methadone clinic on top of the 250 clients you have. So you anticipate that you could serve about 750 clients.
Well, we could. A lot of our clients now are a service. You know, after the pandemic, many of our clients they do telehealth. We have a telehealth license also. So we have people that come in maybe once a month because all their services are rendered online.
We have some hands up. Hold on a second.
Sir?
Anthony?
Yes, hello, everyone. I'm sorry, I got on the call a little late. Where is the location again on Gun Hill? Could you give
Yeah,
me?
I don't know if you were talking to her before.
Can you
It's
can
10,
you?
John, can you mute yourself?
It's 1080 East Gun Hill Road.
And where is that exactly? Could somebody give me a little precise
Just
location?
before you get to Laconia on Gun Hill Road.
Oh, so is that by Caldwell or driving?
It's between Paulding and Laconia.
Oh,
Yeah.
okay. All right. This was my concern. My concern is, someone had asked about the safety of the school. I understand that you're going to be actually medicating some of the clients, and some of the clients going to need different medicine. My concern is like you're going to have some clients that might relapse that have to come back to the program. Am I correct?
Yeah, every program has clients that relapse. No one
Right,
gets the
right,
first try.
and everybody deserves a second chance and everything. My concern is the youth. Like you probably do need to have somebody like maybe when the kids are going to school or coming home from school, it should be like extra security over there. I don't think that we should be really like taking that for granted, because not even that they might do something to the kids might interact with them and it might be ugly, so I think the safety measures, as far as with the school, definitely has to be like an issue. That's
The,
definitely for
the,
me.
well, Anthony, the cutoff time for the medication would probably be about 1 o'clock, 1 or 2 o'clock. The methadone usually dispensed early in the morning, 6 o'clock in the morning, 7 like that. So about 1 or 2, they're kind of winding down. We've had a very large adolescent population for a while, like non-secure detention, where the kids they're not in Spofford, but they're in secure detention. They're brought over, by the juvenile counselors in a van. We service them, they take them back. So we do a lot with the community in terms
All
of
right,
that
now
also.
now do you have age variance from there, or it's just open to whatever a minimum age, or what
We're
is the
licensed. We're licensed from just age 13 and up, and our oldest client might be 72 or something.
oh, okay, so the minimum, all right, okay, all right, thank you for that one.
Thank you,
You're
Anthony.
welcome.
Could you share some outcomes or some stats, you know, based on the services you've provided that you've seen?
Some out,
Yes,
you're talking about some outcomes based on.
your services that you're providing to this population.
Yeah, well, the outcomes are it's an alternative to incarceration. We work also with the treatment court. So what that looks like is a person will be arrested for, a crime committed during the process of using drugs, or a crime committed in the process of seeking monies for drugs, and then they'll go and they'll find out that it's not really it's criminal act, but the person has more of a significant substance abuse problem. So they will mandate them to come to treatment to Vertex. And upon completion of our program, because we take their urine, and completion of the program is based on anticipated data completion, participation in the program, the level of participation in the program, their attendance, and their urine results. So once those things are cleared and law enforcement is satisfied with that, they would go back to court and they would be able to not have that felony conviction. They might have a misdemeanor conviction, or in some instances there's no charges at all based on it. And depending on, we've had times where someone would be sent to us from parole, person would be compliant, and their urine is clean, the attendance is good, and then they would stay in the program 9 months, and at the end of the 9-month period, parole said, that was good, do it one more time, and then we'll put them back in the program, and they'll do it again, because law enforcement has the lead. We consider ourselves to be community partners. The people that are referred to Vertex and programs like Vertex are those people who have that there's a realistic expectation that this person can be successful in our environment. People that come in, we do what's called locators, level of care, determination for treatment referral. Every person gets that, and at the end of the locator, you ask the questions and the answers are given. It will tell you whether or not a person is appropriate for Vertex. Do they need to go to detox immediately, or do they need residential treatment? So that way everyone is put in the type of modality that would be best suited for them to get the biggest bang for their buck in terms of treatment. Outcomes good. We have you could probably look that up statistically through OASIS. You know, we have a lot of people that come in. We're at, in some areas, we're at the highest in the state. I think we do a really great job over at Vertex. We have a criminal justice track, which we're very, very proud of. Our criminal justice track is criminal specific, because if a person is running back and forth all night, buying crack or drugs 11 o'clock at night till 6 o'clock in the morning, he's out there. There's somebody out there selling it to him at that same time, and that person comes with a whole different multiplicity of issues, and we address those behaviors, because what we're looking for is to be able to have people to make those solid decisions when they're alone by themselves and they're not with their counselor or they're not with their family members. We have a conflict resolution program for our adolescents. It's framed off of the SAMHSA, the federal government's anger management program, but Vertex did not want to we did not want to label our adolescents as angry, so we changed it somewhat, and it was approved, and we use it at probation and we use it in court. And what the goal of that is when the kids are out and they're with their peers, because peer pressure is very significant, when they're out with their peers, that they will be able to say, hey, no, I don't think I want to do that, and still walk away with a little swag. That's the goal of that.
Okay, Anthony, you have another question?
Yes, I do.
Yes, I do.
Paul, I just want to ask you this. Two questions.
Okay.
The first question is what is the average amount of time?
Anthony, we're hearing echo.
Yeah, I don't know why. What is the average amount of time, say for instance, if they're mandated from court, how long will they have to stay? Like, are you residential?
No, sir, we're outpatient.
Oh, so what you do is you refer them to a residential.
If they need. That's why I'm saying the locator would determine. Say, for instance, you're a probation officer and you say, hey, you're using drugs, you need to get yourself together and send to Vertex. And you're sent to Vertex. After we do the locator, I might find the severity of your issues might be deeper than what the probation officer imagined or anticipated. And I'd say, hey, you're going to have to be referred someplace else. So I'm not going to say send the person away. I'm going to make the referral to the appropriate modality, and then I will inform them that the person has been referred so that they will know where it is. You won't come to Vertex and just don't get serviced. If we can't service you there, we get you services.
Right. So what do you're like a referral where if they need detox or if they need some type of assistance, you guys refer that, and the courts also reach out to you guys too?
Yeah, let's say hypothetically, I'll give you an example. A guy comes to me, this happens often. He's been in prison for the last 8 years.
Right.
He gets out on Tuesday morning. Tuesday morning, he goes to see his PO. Tells his PO, I'm using drugs, I need help. The PO sends him to me at 2 o'clock in the afternoon. I say, hey, what's going on? I just got out of prison. I got to go to detox. Why? He said, because I have a dope habit. I said, but you've been in jail for the last 6 years. He said, yeah, I've been shooting dope for the last 3 years in jail. Okay, so then that person, I send them, I'll have the van. They're one of the detox agencies. They will send a van, go and pack his clothes, and they'll come, they'll pick him up, they'll take him there, he'll go to detox, and after his detox and he's stabilized, then he'll be able to do outpatient that the parole sent him to do.
Oh, okay.
Now, in the event that he comes, because sometimes outpatient is not for everybody, Anthony. Some people don't have the wherewithal to be able to do that, and not go out and rob and steal in the middle of the day after they leave us or whatever. So we'll send them we'll refer them to residential. It's called a higher level of care.
Right, but the outpatient, do you guys drug test and take urines too? Like with the outpatients,
Yes.
is that mandatory or is it just randomly?
Mandatory, and it's done randomly.
Oh, okay.
Got to check that oil. Got to know what you're doing. You want to know, you talk the talk, are you walking the walk? We need to know. And once everybody that works at Vertex has been fingerprinted, they've been background checked, because any interaction and any document that we have turns into a legal document. Because in many times, in many programs, some people, they don't want to talk to the counselor. They want to go, they're more open and more honest with the maintenance man. They're going to go tell him and what's going on, and then the maintenance man will tell the counselor. It's like that.
Okay.
It depends on the rapport and relationship. That's why everybody background check, fingerprinted.
The reason why I asked you that because my union has a membership assistance program, and I was working with them with that, and we used to take people to the detox and get them to meetings and all that type of stuff. So that's why I was asking you that, because
What's your union, Anthony? What union?
local 79, the labor's union.
Oh, okay. We've for years we've done the
They
we
have the
do the
MAP
EAP.
program.
Yeah, we do
MAP.
the EAP for transit. You know, like
Yeah,
when
because that's like a city agency. We private. I'm construction industry, but so they have MAP, membership assistance program,
yeah,
and
that's one of the rich guys with the rich program, rich, a lot of
it's
money.
just to tell you the truth, they really don't even talk about it. And have the construction workers, they be twisted on the jobs too, like
Yes, that's
So
right, and that's dangerous. They can get hurt too. But no,
absolutely.
we did like we had the guys. We have guys that come in. They have a history of substance abuse. They've had some issues. They apply for a job for the train. So initially they said, "Well, can you just check their urine?" Then I explained to them, taking this guy's urine one time doesn't really know. We need to know what's going on. This guy's driving a 8 million-pound train or something. We need to know.
Right,
So we put
right,
him in the program
absolutely.
for a few months, and we did that with the conductors and the bus drivers. We've been doing that for a while.
Yeah, that's local 100. I'm familiar with them.
Yeah, over in J Street.
Yeah. All right.
Okay,
Thanks for that. Thanks for the answer, Paul. Appreciate that.
do
I
we have
appreciate
any
you.
other questions from the board?
Paul, do you have your information in the chat?
I just parked now. I'll put it in there as soon as I can.
All right. Thank you.
Okay.
Any other questions from the board? My last question is, does this facility, your clinic, so now you're adding, what you're asking for is a letter of support. Am I clear to add a mental health clinic component and an opioid treatment service component?
Yes, with substance abuse and mental health, co-occurring disorders, they run so close together. A lot of people are using drugs, and then they hear the voices, and then people hear the voices, then they use the drugs. So it would be, and the waiting list now, it takes like 2-3 months. If you can get someone to get to you for your mental health assessment within like 8 weeks, you're really doing good. So we're imagining that we'd be able to cut that time down tremendously. And the law enforcement agencies that we partner with are very excited about that also, because that gives a quicker opportunity that we can stabilize someone. And that is going to definitely have an impact on public safety.
And the population that you're serving, where are they coming from? Is it just our district or all over the 5 boroughs?
Well, it'd probably be the Bronx.
It's primarily the Bronx in the north ports, in the north
Yeah.
section of the Bronx.
Okay, but
Not
if
all
they
of
can
them.
come from, so you're saying that the majority are going to be from the Bronx?
So everybody, yeah, basically. No, see, the every now and then, rarely someone may want to go for substance abuse, not in their neighborhood, because maybe it's family stigma, maybe they're embarrassed, something like that, and they might want to go someplace else. But our oversight agency, OASIS, our licensing agency, says that everyone has the right to have substance abuse services near where they live, and they also have the right to pick and choose where they want to go. So I can't make someone come to Vertex. It's almost like the New York the law for working. I can't make you not quit working at Vertex, and you can't make me keep you.
Thank you, Paul. Any other questions? None? Okay, so for the committee, our committee members, we only have Mr. Deacon Brown and Ms. Ortiz. We're missing 2. So my recommendation is that we take this to our full board meeting. Paul, can you unmute yourself? I think that's where the echo is coming from.
Oh, it's me?
We still could take a vote, because you got community board members here.
But they have to be from the committee, no?
Well, yeah, they should be on the committee, but
Yeah.
if they take an interest in coming, they should be able to vote one way or another. And at the board meeting, we state that the full committee was not present, but there was many board members present, and we took a vote. And then it's up to the full board, who appears on end of June, to see if they want to approve what the board members and the committee members that are here voted on.
Okay. I personally feel I need a little more information before I cast a vote.
Okay.
Deacon Brown, What are your thoughts, Ms. Ortiz?
Yeah. Wants to know what your thoughts are.
Based on what you've heard today? Is it enough for you to cast your vote, or do you feel like you need a little more information?
Well, the,
Yes.
they explain exactly what they are here for. So, if the committee that is involved, I don't know how many of us were there, they would be able to say they approve for it to be taken to the general board. I mean, it's, it's not a,
Well, what they're looking for is a letter of support. So today the committee would vote on, do we recommend the letter of support or not?
well, you have my letter of, that I give them the letter of support. I think this is a good program. I mean, there's been a lot of them all over the place, and this is a new one. The only thing is that I think it was, I don't remember who was that asked because of the school. How are they from the school, and what, and what would it obtain for them for this, how far are they from the school?
About 2 blocks?
2 blocks?
Yeah, but they also been there for a lot of years.
Right, but
No,
they're
I know
adding
that they have been,
services.
yeah, because they have one in Jerome. I think
Yes.
Montefiore heads that one in Jerome. I'm not sure if it's them, Bertis, but I know that there is one in Jerome.
Right. Mr. Deacon Brown, what are your ideas on this?
I vote yes.
Okay. Anthony Reed, you have your hands up?
Yes, I just wanted to know if anybody how's the police activity? Did we have any issues with them? Do they have any facilities not in our area that we can check to see how, like, what type of activity they have? If they have police activity, did they have problems anywhere else? Did
So
anybody check to see that?
you're saying we should get like the report from the precincts if there's been any complaints.
Yeah, absolutely.
So that's your recommendation.
This is not my recommendation, but I just think that should be a done deal. We should do that anyway. Like,
Right, but you have to voice what your opinion is, right? So you're
oh,
saying that right now you'd like to see a precinct report.
yeah, I'd like to see if they had any bad activities and what's
Any
going on in
complaints?
their facilities. Yes.
Okay. I like that idea as well. Um, Talene, you have your hands up?
Yes, just a quick question. Who is on this committee?
Ms. Ortiz and Deacon Brown are the only ones here today. Shaniqua Moore is missing and Ms. Broomfield.
Okay, so Shaniqua Moore is no longer with the board.
I'm not aware of that.
Yes, I am. It is a fact.
Okay.
So there's 3 members of the board.
Yes.
Okay. Thank you.
But do you have any recommendations, Talene? What are your thoughts? You were an educator. What do you think?
Yeah, because that was my area. I was the dean over
So
there.
what are your thoughts?
Vanda. I'm along with what Anthony is stating, because I'm wondering, Mr. Henderson, is Mr. Henderson?
Yes. Yes.
Okay, my name is Talene Dickerson. I'm the
How you doing, Mr.
education.
Dickerson?
Good, thank you. I'm the Education and Youth Services Chair for the board, but I was
Okay.
also the dean and the building response team leader at Evander.
Okay.
So, right, that area, that area is a very hot area. I'm not sure if you've been in that area, if you've spoken with, inside of Evander down in the lower level, they have a police task force. If you've had any conversations with them.
Well, let me just say that, let me just start with Mr. Reed and the 4-7. We have an amazing relationship with the 4-7. They were just over there a couple of weeks ago getting some feed from our cameras, something happened at night, so that they come over there and do that. We usually do when we do our block parties, and we do one in the summer for 4th of July. We do a cookout for neighbors in the neighborhood. We usually go over there. We're okay. We've been to. I've been to Evander. There's another junior high school up Bronxwood. Went up there. We did them a courtesy and did some drug testing for their football team. So we tried to, like I said, we had an adolescent component, very strong. So that's important. In addition, I'm an educator. I've been a professor at Metropolitan College for the last 23 years. Education is a very big component for me, and I think it's good. I think the services that we bring, that we're trying to expand and add after it's going on 18 years that we've been on Gun Hill Road, there's never been any issues over there. I mean, we do a good job. We try to maintain, treat people with respect, and we're trying to get that back from them because we believe in leadership by example.
Okay,
So
you said that you were, Mr. Henderson, you said that you were at Evander doing what, may I ask?
just letting them know that we were up the street and that we were available if they have any substance abuse issues with any of the students. We're down the street and we're ready to help, and we're competent.
Do
That's
you
what we're there
remember
for.
who you spoke with? I mean, what was it? The whole school? Someone in particular? The police department downstairs?
Once it was I'm sorry, I don't have that in front of me. I didn't know I would need that, but
No,
I don't
it's
have,
okay.
no,
I'm
I
just
don't know the
curious.
person's name. I'm sorry. I don't know the name.
No,
I'm sorry.
not a problem. I'm just curious if you spoke with school safety or you spoke with, staff, or who you spoke with. And is it possible you can
Both.
say who you
Both.
spoke with who you work with the 4-7?
Well,
You're
it
saying you have a
was,
close relationship. I'm just wondering who your close
well,
relationship is with.
when Ruel was the inspector, Stevenson, he went down. He's chief now. And then he left. I think the guy replaced him. I think his name was. They just got a new guy maybe about 4 months ago. The last person before him, I want to say was Rivera. I think it was Latino guy. He was a good guy. Had a good reputation. One of my nephews on the job. He told me. So I met him over there. So we deal with the community affairs officers often. Like when we have something, they come by. But I'd have to get my cards out and tell you their names.
Yeah, I would appreciate it. Thank you so very much.
All those are the things that help us because we do want to make sure that the community is informed and that we do have their feedback, especially when there's a school so close. So these are just questions that are going to come up for you at the full board meeting as well. Just FYI. Next up, Mr. Hall, you have your hands up.
Yeah, no, Mr. Henderson has had an answer for every question, and he's done an elaborate job. And I'm just going to say that I did take a tour of Vertex years ago when Ruth Hassel Thompson was the senator at that time. I took it with Donna Drayton. All right. I personally have no problems with this. I just wanted to know if we were to give out a letter of support, this support is going to give them what is exactly this support going to do, this letter of support in the interest of Vertex? Go ahead, ma'am.
Thank you. So the support, first of all, the support letter is part of an application process that needs to be, that includes several other items. It goes to the state of New York. It also goes to, for the opium program, it would also go to the feds. For the mental health application, it goes to the Department of Health and to the Department of Mental Health. And it's just part of a package. So this is just the initial process so that we can submit an application and then go through their credentialing process. And that can take anywhere between six months to 1 year.
Okay.
So what you're basically saying is like you're putting in like a RFP, you're filling out an application to get funding to start this?
No, not to get funding, but to be able to be licensed to do
those.
mental health, specifically mental health, as a mental health facility, and or to be licensed to provide methadone, because you have to be licensed in order to provide this particular service.
Okay, Mr. Hall.
We're licensed already as an outpatient SUD program, so that's licensed. We're licensed for telehealth services. We're licensed for other services that we have. These are the two other items that we want to add to expand and basically make the program a full wraparound service.
You'd like to add the opioid, is that correct?
That is correct.
Okay, I wanted to be certain on this. And one of my major concerns, I listened to everything that was being said, and you know about the school that's 2 blocks west. But if you go 2 more blocks, there's a housing development, and I happen to be the president there, and I'm very much concerned. But you've done a marvelous job to this point. And I just don't want you to overextend yourself. But I know it is very important to have this opioid in this community. All right, it is vastly needed. So I mean, I have to take that into consideration. It's a real catch-22 here. You know, not that I'm opposed, but I want to make sure that Vertex remains the same Vertex that's in existence now and doesn't overblow themselves. And that's something that I'm concerned about. That's all. I yield.
Thank you, Mr. Hall. I echo that. And for me, even more so is again the proximity to the school. And I know up to now, it seems like there haven't been any issues. We can definitely check in with the 47th precinct, but you're talking about adding at least another 500 more potentially. And so that concerns me a little bit. Ted, you have your hands up?
Yes, I wanted to find out, I'm not sure if it was said, but how are you currently being funded? And also the clients that come to you, do they have to pay? What's your basic profit motive here?
Currently we are reimbursed from services from person's private health or through Medicaid. If a person doesn't have insurance, then there's a sliding fee scale. If the person doesn't have any money at all, we're going to service them anyway. I'm guaranteeing if tomorrow morning any one of you call the Bronx Legal Aid or Bronx Defenders and say, hey, I have somebody who's undocumented, they have no money, they need substance abuse treatment. Do you have anybody in the Bronx that's going to treat them for free? I'm guaranteeing you're going to get my number because we do about $500,000 of free services a year at a minimum. But the other part of it is that the people using drugs in the neighborhood, whether we expand or not, they're still going to use it. And yes, Vertex, it would be nice if we could stay the same, but we can't because things around us has changed. Vertex considers ourselves, we don't want to be a thermometer and measure the problems and the crimes. We want to be the thermostat to change it. And that's what we're trying to do now.
Thank you.
Thank you.
Stephanie Roth, you have your hands up?
Yes, I'm sorry. I'm in a supermarket. I apologize. I formerly worked in substance abuse. I'm a school social worker now. Do you have? I just had a few questions because I got on a little late. So this is an already existing program that you want to expand the services. It's already housed in this vicinity. Is that correct?
Correct.
Okay. And do they currently offer or are they seeking any services? Like I used to work at a substance abuse program where they had a grant from Oasis and they had social workers who worked for the program, and we would cross refer and be in the schools during the day. And we would be substance abuse social workers on staff through a grant from Oasis. So we were in the middle schools, the high schools, and then like you wouldn't see a student from your own school, you would see a student from another school. And then we had support groups and a really nice wraparound program. And it was a great resource for the district. I was curious if that model, we had COSA groups, which is children of substance abusers. It's a really great resource. I was just curious if they would offer any services like that.
We don't receive public funding other than the medical insurance through Medicaid. Vertex is a for-profit, meaning a private company. We're not a nonprofit organization. And so in terms of the availability of these grants are not necessarily available to us.
Right. Okay. Because I
Wish they were,
thought,
because yes, I would write them all up.
because they were grants, they were grants. So I know we got funding through Oasis grants that they applied for. I don't know what the origination of the agency was that I worked for before that. I would say they were, for profit in the sense that, I mean, they had to pay us salaries and things like that. So we didn't work for, some like a hospital system. We were an independent agency, but they wound up having several offices. It was a really great program, and they even had their own private AA meeting for they had a kids AA meeting. It was nice. My only question was, has there been any consideration of hours of the program, not necessarily dismissing clients of the program during the dismissal hours and opening hours of the school? So it's sort of, if you're having clients come in during the school day, not such a problem. But if there's a lot of people hanging around from the program afterwards. And I wanted to ask, what age is the school in the vicinity? I didn't hear that, if it was like a high school or middle school. Hello?
It's a high school.
Okay.
And
So
no one hangs around after they leave Vertex. They have to leave. Okay. We don't have anybody standing outside in any of our facilities.
Yeah. Okay. I just wanted to ask.
Thank you, Stephanie. I have to move
thank
on.
you. Sorry. Yep.
Michelle, you're a committee member. Do you have enough information to make a decision? Do you need more information? Do you have any questions?
I came on late, so I'm not sure. It seems like it's a methadone maintenance program being asked, I guess, in the area, but I'm not sure even where the location is.
Jesus Christ.
Okay, so we're gonna definitely have to take this to the full board meeting. I don't want to keep anyone any longer. And Michelle, you should definitely inform yourself more before you actually make a recommendation or a decision. Anyone else? John?
Yes. I just want to let everyone know I'm totally in support of this program. And if you guys ever wake up early in the morning, like how I do, go out there at 5 o'clock in the morning and see the people on the street. We have brought all these homeless shelters in the neighborhood and all these people here with problems. We need help. So if there's a program that's offering help, we need to expand and take it. I mean, we when you out there are people laying out all in the middle of the street. There was a lady twerking in front of my bus a couple of weeks ago. We need help. Down by Dyer Avenue is bad. Gun Hill Road is bad. It's really bad. We need help. And that's my comment.
So I still have the question only because like I came on late again. So where would be the location of this program? That's all I'm asking.
So Michelle, may I respond? So Michelle, we're located at 1080 East Gun Hill Road. And it's not that we're doing a new program. We're expanding a current outpatient program that's been in existence since 2006 for the last 18 years.
Thank you.
Michelle, they seem to have a successful Paul, can you mute yourself, please? They seem to have a successful program. It's been around, like she said, for 18 years. They're asking for a letter of support to expand in adding a mental health component, clinic component, and a opioid treatment component.
Opioid treatment component in
Yeah.
terms of methadone maintenance. Is that what we're saying?
You broke up. What?
Is it a methadone maintenance program? That's the opioid.
It is.
Okay, thank you.
Any other questions? Again, we're not saying we don't want this. We just want to make sure that if the board does recommend that we do provide a letter of support, that we do have the other factors taken into place, like security. Michelle, I don't know if you missed it, but is 2 blocks away from Evangerville High School. We just want to make sure that the proper measures are in place. And we do agree with John, we do need additional services because we do have transitional homes, shelters, asylum, facilities that are being placed here as well. We just want to make sure that if we're adding more, right, and there's people not just from this district coming, people from all over, that we do have the proper measures in place to provide safety for all. Yes, Keisha?
Two quick questions, and I'm sorry if they were already answered, but if this is approved and they take on this new component, will there be additional staffing at the facility to support the influx in patients? And then the second, and not that it matters, just curious, do the current staff members, do any of them live in our district?
The answer is yes to the first one and yes to the second one. We do have staff members. Again, being a community-based private company, we do have members that do live and reside in the immediate area. We also have and obviously as you expand your services, you need to expand staffing. So when we hire, we try to hire as best as we can to hire within the community because that's very important.
So I didn't raise my hand, but so my only other question is because I'm the mental health part fine. I'm just curious to say, as far as needs assessment for the area, we know that adding methadone maintenance to your program would benefit. There is a need for another methadone maintenance program around. There's no other methadone maintenance program close by to where your location is.
No, there isn't.
There isn't any other methadone maintenance program here.
No, Vertex is the license, the New York State license program farthest north is our location.
Okay. So I'm okay. I'm just, well, I guess as the chairwoman said, so I would need to just look into seeing that there are no other methadone maintenance program close by in that proximity. There are what do you call, there are like assisted living programs that are has methadone maintenance residents with that, where living in their facilities. And I'm just curious to say where they're getting their methadone filled at. Only because they are assisted livings close to Gun Hill Road. So where are those residents going to get their methadone? And so currently there's no one close to that area, close to where you're located. So I just want to know that for sure for myself.
Thank you, Michelle. Keisha, do you have your hands up again, or was that from before?
That was from before. I'll lower in a sec.
Okay, Ms. Benitez, I see you're on. Do you have any comments or questions? Ms. Benitez? Okay, Benga, do you have any comments or questions? All right, they're not with us. Committee members, I feel like I need more information. I don't know if you do. I recommend that we bring it to the full board meeting, which is next week, next Thursday. Are you on a deadline, Vertex? What is your timeline for this?
We can work with you. The process normally, what we do in this situation is we talk to the committee, we get a recommendation from the committee, get a letter from the committee, then we do the same presentation for the full board, and it's okay. I understand the process.
Okay. And some of the questions that you answered today, I don't know, you didn't really put a presentation up today, but I would recommend that you bring some stats, you bring a little more information, look into how can you enhance security. I know you said it's just right in front. Again, our concern is that there is a school.
No,
So if you can
no,
come with some,
no, I didn't say right in front. I said that it would be, the security would meet with the shop owners and it would expand all the way down the street into the 4 blocks, because the school's 4 blocks from our office. It would expand there to make sure that the clients kept it moving. That's what I said.
okay, but what does that mean, right? Like our board is gonna want to know, what does that expansion mean? Are they gonna be patrolling up and down, or how
Yes,
does that?
yes. That's how you
Okay.
do it. You walk up and down. They'll be on both sides of the streets and somewhere, sometimes off the corner of the street. Yes.
Okay, Ms. Benitez, are you with us?
Yeah, I just wanted to ask a question. Is there a time frame on this letter of support that is needed?
Well, I'd like it sooner than later. I mean, if you could have it to me within next 60, 90 days, I wouldn't be mad at you.
You wouldn't be mad at us. Um, I have a concern because I did come in late to the meeting. I must apologize, but my thing is that you're talking to us now and you're giving us a verbal. Were there no slides or anything like that when you gave your presentation? This is an all verbal presentation that you're giving us?
Well, I didn't know that you required a slide. I mean, I
Well,
I didn't know. I mean, if you want slides, you can have that. You want
well,
statistics,
it's
you can
not so
have
much the
that.
slides,
I,
Mr.
yeah,
Henderson, is
I'm
that
sorry.
that
Yes.
you were prepared to come into to convince us as a committee to give you a letter of support. And I would think you would have backup documents. You would know who you were dealing with at the 4-7 precinct. You would have those names that you could give us so that we know, how involved you are with the surrounding
Right.
community. For us to go into a board meeting next week, Ms. Coronel, we can't have another committee meeting in the middle of a board meeting for him to come in with presentations. That's a committee process right there. And to take up the time of the board, if we can't decide tonight whether we're going to give him a letter of support or not, I don't feel that we should put the burden on the full board to become a committee to decide whether we should do this or not. That's my concern, Ms. Coronel.
Okay, thank you, Ms. Benitez.
You're welcome.
So the time frame, just to give you a heads up, the Vertex folks that are here, we do go into recess for July and August, which means the next opportunity for a more in-depth presentation. I personally feel we do. I get a census that other board members feel we do as well. Then that would be September. How does that affect you guys at Vertex?
For the application process, they would put us behind about a year because there's 6 phases to the application, specifically for the mental health and for the OPM. And so what happens is that the teams that are already been selected by the state regulatory agencies, they're expecting, they give you these milestones that you need to meet. And so they also know that the summer's coming up and that the committees and, a lot of the committee board meeting, boards finish up in June 30th. And so, yes, it would hinder our process and hinder the state process to get, go through the application process. But we are at your mercy, and so we need to do, I understand and appreciate that everyone is concerned and is requesting more formal presentation. So, it's we're gonna lead. You're the lead. You let us know what you need from us, and we'll follow your lead.
Thank you, Jen. I have some hands raised. Ted James and then Anthony.
Hi, Mr. Henderson. I understand what you're doing, but my concern is it's all good and well to have treatment, but what about prevention? Are you working with other organizations or other groups or even within your own organization to have preventative measures so that these folks don't come to you. I mean, it's probably taking bread out of your pocket, but we would like to see more preventative measures in our community rather than just having treatment programs.
Hey, I'll take a look at that then.
Thank you, Ted. Anthony?
Yes, my concern is, you said it's going to hold you back another year, right, Ms. Rivera? But what I'm saying is, if you knew all of that about the community board and we was going on recess, why do you wait till June to come to the board?
So we were actually going to meet with the board. I believe it was last week or the week before, and so I understand that was postponed, and then there were some other things that got involved in the middle of us rescheduling to come to the committee. It's just sometimes, logistics. We don't always have control of everybody's schedule and trying to get everybody in one place to try to move forward these applications or these requests doesn't always work out the way we plan.
Right, but that's not our fault. You already
No,
knew
it's
that
not.
we was going.
I'm not that's not the statement that I'm making.
Because I feel like when you said a year, it was like some pressure. But we got to go through our process also because we here for the community.
That is correct. Which is why I said that we will follow your lead.
Thank you, Jen. Any other comments before we close? So our recommendation.
I just want to say thank you for your time, and I appreciate everyone. And we'll
We
take your
appreciate-
recommendations and we'll get it together for you.
Thank you. We appreciate you coming to the board. At this point, we're not comfortable making a decision. So we will propose that we bring this to our committee, next committee meeting, which will be in September. Hopefully we can connect before that with more questions that we may have and more information that we're looking for before we make a decision. Any questions?
On behalf of Vertex, again, we appreciate everyone taking the time. I know that, everybody's home and, getting everybody's schedule to try to bring this, we greatly appreciate it.
Yes, and again, thank you. We know these services are needed. We're just under a lot of matters coming across our board right now, so we just need to make sure that all the pieces are here in place for us to really offer a better quality of life for those that live here, not just for those that live without our district within the Bronx.
I would also, if you don't mind, Madam Chair, to send some more further information, and perhaps you can share that with the rest of the board members. I will get you the data that you requested because we have all the data that's been discussed, and we can, a nice presentation, and then you can share it with everyone, and then maybe hopefully you guys will be able to make a more informed decision, including.
That would be amazing.
Maybe even doing, come down and visit us.
Right. Some folks may want to do a site visit, so we will definitely stay in contact.
Okay.
Any other questions before we close? Can I get a motion to close?
This is Robert
I make a
Hall.
motion, Anthony.
Okay,
Second,
so
Robert Hall.
thank you. Thank you all. Wishing you all a blessed and safe night. And thanks again to all the Vertex folks for presenting. We appreciate what you're doing in the neighborhood. And we'll talk again soon.
Thank you.
Bye.
Have a good night.
Good night.
Good night.
Good night.